Hi, my name is Kaitie Clarke and I am a second-year Doctor of Physical Therapy student at Regis University. I have such a passion for the field of physical therapy and I'm excited to be a future practitioner of this profession. At this point in my education, I have many areas of practice that interest me. I do have a strong background in outpatient orthopedics. I worked for 2 years as a physical therapy aide in the outpatient setting, and I've done my first 2 clinical rotations in that same setting as well. That being said, I also have a great deal of interest in the inpatient physical therapy practice and neurological physical therapy, and I would love to explore these settings more. When I think about needing to be flexible in the clinic as a healthcare provider, my biggest strategy is to usually just take a second, take a step back and humble myself and remember that the situation is usually not about me. As much as I have my own goals and my own agenda of what I think needs to get done during a treatment setting, I need to remember that there is so much more going on in this patient's life than the health condition that I'm seeing them for. And so when I put that into perspective and consider this patient as their entire being, an entire person, it makes it so much more easy to be flexible and to roll with the punches when obstacles arrive. Examples of how I receive constructive feedback. When I am receiving feedback, I try to consider its intent. And the intent of constructive feedback is that of helping and of bettering. And so when I receive feedback with that mindset, I'm able to accept it with more grace and more appreciation. One thing that I do like to do is to be intentional about having an early conversation with my CI or with the person that is giving me feedback about how they like to give their input and how I can best receive it. And having this conversation early on allows us to better understand each other and to give and receive feedback more effectively, and it really reduces the possibility for miscommunication. In preparation for my final 2 clinical rotations, I plan on taking electives for manual therapy and neurologic physical therapy interventions. I also plan on reviewing my foundational concepts and the principles of physical therapy assessment, examination, and intervention. Once I graduate, I plan to be a practicing clinician for 3 to 5 years. After that, I plan to participate in a residency program in my field of practice so that I can continue to perform at the top of my scope of practice and further develop my leadership skills. Thank you so much for listening and for taking the time to get to know me better.